This is China Gateway 360. China just changed how hospitals get paid. Foreign healthcare firms, take note.
To understand what's happening, we need to look at China's National Healthcare Security Administration, or the NHSA. They are fundamentally redrawing the map of healthcare demand right now. What they're doing is taking purchasing power away from those massive flagship hospitals you're probably used to dealing with, and they're funneling it straight into primary care.
How are they doing this? Well, it all comes down to a brand new tier-blind payment system. The state has decided they will now pay one identical flat amount for a specific list of common procedures. So whether a patient gets treated at a top-tier city hospital or a small rural clinic, the insurance payout is exactly the same. Practically overnight, the financial incentive for patients to crowd into those mega hospitals for routine care is just gone. And that list I mentioned, it covers exactly 158 ailments. That number is your key takeaway here. We're talking about everything from basic hypertension management to minor surgeries. By equalizing the payouts for these 158 specific conditions, the government is deliberately and systematically redirecting patient volume right down into local community clinics.
Now, you might be thinking this is some overnight whim, but it's actually been a long time coming. The whole tiered diagnosis framework technically started way back in 2009, it just lacked teeth. But that changes now. With a hard payment rule officially taking effect in August 2026, we're looking at a massive, multi-year tailwind. It's going to push high-quality medical resources down tier, straight through the 15th five-year plan.
China Gateway. Gateway.
Your gateway to business in China.
And we aren't just guessing about the impact. This shift is already entirely measurable. If we look at the recent pilot data coming out of Shandong province, we can see exactly how fast both patient flow and capital are moving in real time.
The numbers validating this are genuinely staggering. Just looking at the first quarter of 2026, grassroots institutions in Shandong handled over 82% of cases for common conditions. Think things like pneumonia and appendicitis. Over 82%. And the money is definitely following the patients. To back this up, the province allocated 32.6 billion yuan. That translates to roughly 4.8 billion US dollars, directly to community facilities. To put that into perspective, that is a massive 20.1% jump in grassroots funding compared to the pre-policy baseline. So what does this all mean for you? If you're running a foreign healthcare firm, this demands a total paradigm shift. The old playbook relied heavily on brand trust and selling premium surgical devices into those Tier 3 hospitals. But the new reality? It's all about massive volume expansion right at the base of the system. It's a market driven by convenience and these newly equalized reimbursements. To actually win in this new environment, you have to optimize your portfolio, and you need to do it in two ways. First is what we call the value play. You need to focus on point-of-care diagnostics and chronic therapies that are specifically tailored for the tighter economics of a community clinic. Second, you have to build a trust bridge. This means pairing your lower-cost products with robust clinician training programs. You need to do this to help overcome any lingering skepticism patients might have about the quality of their local clinics. But a quick word of caution, you have to tread very carefully through the regulatory ecosystem here. This new volume play interacts directly with state bulk buying bids. Plus, with Beijing's ongoing crackdowns on pharma kickbacks, if you're planning to expand your grassroots sales force, you are going to need absolutely bulletproof compliance audits. No cutting corners.
Let's wrap this up with your immediate action plan. First, you need to remap your channel strategies away from a strict reliance on Tier 3 hospitals. Second, get in there and immediately verify and refile your insurance codes. Remember, the economics are now tied directly to the product or procedure, not the hospital grade. And finally, pivot your operational focus toward primary care and telehealth. You have to meet the volume where it's actually going.
Good news or bad news for foreign healthcare firms? Tell us below.